You come home after a completely normal day. You sit down, pull off your socks, and there they are. Deep grooves pressed into the skin around your ankles. Your shoes felt tight by lunch. Your calves look puffy, almost doughy. You press your thumb into your shin, and a dent stays there for 5, 6, 7 seconds before the skin slowly fills back in. And you tell yourself the same thing millions of people tell themselves every single evening. I was just on my feet too long. I probably had too much salt. It is nothing. Let me be direct with you. That is not nothing. That is your heart sending you a message through the only channel it has, your body. And if you keep ignoring that message, what comes next is not more swelling. What comes next is a hospital bed. Subscribe and hit like right now. What you are about to hear is the kind of information that does not come up in a 12-minute office visit. The system is not set up to explain this to you. Help Dr. Johnson reach 200,000 subscribers. Every single one counts. Most people with chronic leg swelling go straight to the wrong specialist. They see a vein doctor. They buy compression socks at the pharmacy. They elevate their legs at night and hope for the best. Some get prescribed water pills and are told to watch their salt. And nobody, not the pharmacist, not the vein clinic, not the internet, sits them down and says the 5 words that could change everything. Your heart is not coping. That is what this video is for. I am going to walk you through exactly what is happening inside your body when your legs swell, why the heart is almost always involved, what the early warning signs look like before real damage sets in, and what you can actually do about it starting tonight. To understand why your legs swell, you need to understand one basic fact about your body. Roughly 60% of you is water. That water is not sitting still. It circulates constantly inside your blood vessels, inside your cells, and in the spaces between cells, what doctors call the interstitial space. The system that keeps all of this fluid in balance is extraordinarily precise. Your heart pumps blood forward, your arteries carry it out to the tissues, your veins and lymphatic vessels carry it back. When everything is working, fluid arrives, delivers oxygen and nutrients, gets collected, and returns to the center. Nothing pools, nothing leaks, nothing swells. But when one part of that loop weakens, specifically the return side, the part responsible for bringing fluid back to the heart, the math breaks down. More fluid goes out than comes back. The excess has nowhere to go except into the tissues surrounding your blood vessels, and gravity decides where it collects. Your ankles, your feet, your calves. That puffiness in your lower legs is not a skin condition. It is not a vein problem in isolation. It is a pressure problem. And in the majority of cases, the source of that pressure imbalance is sitting right in the center of your chest. Your heart cannot generate enough forward force to keep the entire loop moving efficiently, so fluid backs up, pressure builds on the venous side, and water gets pushed out through the vessel walls into your tissues. That is the mechanism. Simple physics, serious consequences. Before we go further, a lot of you have already noticed the Care Health link on my channel page. It has been getting a lot of attention lately, and I will explain exactly what it is toward the end of this video. For now, let us keep going. Most people hear the words heart failure and picture someone clutching their chest and collapsing on the floor. That is not what heart failure looks like in the majority of cases. Heart failure, specifically the early stages, is quiet. The heart does not stop, it weakens. It loses pumping efficiency gradually, often over years, and the body compensates so effectively that you do not feel anything dramatic for a very long time. What you feel instead is subtle. You get winded climbing a flight of stairs, you feel heavier and more fatigued by the end of the day than you used to, and your legs swell. Here is the mechanism in plain language. When the heart cannot push blood forward with enough force, blood begins to back up in the system. Think of a garden hose. When you kink a hose in the middle, water does not just stop. Pressure builds behind the kink. The walls of the hose strain. If there is any weak point, water pushes through it. Your weakened heart is the kink. Blood backs up into the venous system. Pressure rises in the tiny blood vessels called capillaries. That pressure, doctors call it hydrostatic pressure, forces fluid out through the capillary walls and into the surrounding tissue. The fluid has nowhere to drain efficiently, so it sits there. Your ankles thicken, your calves fill, your shoes stop fitting by afternoon. This type of swelling is called peripheral edema, and here is what makes it dangerous. It is often the earliest visible sign of a heart that is struggling. It can appear months or even years before shortness of breath, chest tightness, or any symptom you would instinctively connect to your heart. Most people who have it do not think heart, they think legs. And that is exactly how early-stage heart failure goes undetected. Not all swelling is the same. There are very specific clinical indicators that separate cardiac edema from every other cause. This is the part where most people realize they have been looking at the wrong organ. First sign: the swelling is bilateral. Both legs swell roughly equally. If only one leg is puffy and the other is normal, the cause is more likely a local problem, a blood clot, a blocked lymph node, a damaged vein. When both legs swell symmetrically, that points to a systemic cause, and the most common systemic cause is the heart. Second sign: the swelling follows a daily pattern. In the morning, after you have been lying flat for hours, your legs look relatively normal. By evening, after gravity has been pulling fluid downward all day, the swelling peaks. That clock-like rhythm tracks perfectly with cardiac-driven fluid accumulation. Third sign: the pitting test is positive. Press your thumb firmly into the swollen area for 10 seconds and release. If a visible dent remains and takes several seconds to fill back in, that is pitting edema. It means free fluid is sitting in the tissue. Not that the tissue itself is thickened or scarred. Pitting edema is a hallmark of heart-related swelling. Fourth sign: sudden, unexplained weight gain, not gradual weight gain from eating more. A jump of 2 to 5 pounds over a few days that you cannot explain by diet. That weight is water. Your body is retaining fluid because your heart is not circulating it efficiently. Fifth sign: you are waking up at night to urinate. When you lie flat, all the fluid that gravity trapped in your legs during the day floods back into your bloodstream. Your kidneys detect the sudden volume spike and go into overdrive. You wake up with a full bladder, sometimes 2 or 3 times per night. Most people blame their prostate or their bladder. The real cause is sitting in your chest. When you walk into a doctor's office and say, "My legs are swelling," here is what typically happens. They order basic blood work, a metabolic panel, liver function, kidney function, maybe a thyroid test. They may send you for a venous ultrasound of the legs to check for blood clots. All of that is appropriate. All of that is standard. But here is what frequently does not happen: a direct assessment of your heart. There is a blood test called BNP, brain natriuretic peptide. It is a hormone your heart releases when it is under strain, specifically when the ventricles, the main pumping chambers, are stretched from excess volume or pressure. A simple blood draw can measure it. Elevated BNP is one of the earliest laboratory markers of heart failure. It often rises well before you feel any symptoms you would associate with your heart. Many patients with chronic leg swelling have never had this test ordered because the swelling was attributed to veins, salt intake, or standing too long. The cardiac connection was never investigated. The second test most people have never been offered is an echocardiogram. That is an ultrasound of the heart. It shows how well the heart muscle is contracting, how the valves are functioning, and whether any chambers have become enlarged. The single most important number that comes out of this test is your ejection fraction. That is the percentage of blood the left ventricle pushes out with each beat. Normal is roughly 55 to 70%. Below 40% is considered reduced, and that is a clear, measurable sign of heart failure. If your legs have been swelling regularly and nobody has checked your BNP or ordered an echocardiogram, those are 2 very reasonable things to bring up at your next appointment. You are not being difficult, you are being informed. The swelling itself is not the danger. I need you to understand that clearly. The swelling is the warning light on the dashboard. The danger is what the swelling represents: a heart that is gradually losing its ability to keep up with demand. Here is what the progression looks like. Early-stage heart failure, if caught, is manageable. Medications, lifestyle adjustments, and regular monitoring can stabilize the condition and give people years or even decades of good quality life. That is not wishful thinking. That is what the clinical data shows when intervention happens early. But heart failure that goes undetected because the patient attributed the swelling to tired legs, bad veins, or too much salt, that progresses. The heart begins to remodel. The walls thicken or thin depending on the type. The chambers enlarge. Valves that once sealed properly begin to leak. What was a manageable condition at stage 1 becomes a serious, difficult-to-reverse condition at stage 3. And by then the options narrow considerably. That is not the only risk. Swollen, sluggish legs are a breeding ground for blood clots. When blood moves slowly through distended veins, it clots more easily. That is called deep vein thrombosis. If one of those clots breaks loose and travels to the lungs, you have a pulmonary embolism. That is a life-threatening event that can happen without any warning beyond the swelling you were already ignoring. There is a third layer. Chronic fluid overload stresses your kidneys. Over time, the kidneys begin to lose function. And once the kidneys decline, they can no longer help the heart manage fluid. The heart gets worse. The kidneys get worse. Each one drags the other down. Doctors call this cardiorenal syndrome, and it is one of the most difficult cycles to break once it takes hold. The window for intervention is early. The swelling in your legs is that window. Every patient who walks into my office with swollen legs tells me the same thing. I have already cut my salt, doc. And almost every one of them is still consuming 2 to 3 times more sodium than their body can handle. Let me explain why. Your body has a hormonal circuit that regulates how much sodium and water your kidneys retain. It is called the renin-angiotensin-aldosterone system. In a healthy person, it works quietly in the background, adjusting fluid levels based on what you need. But when the heart weakens, this system overactivates. The body interprets reduced cardiac output as low blood volume. It panics. It sends a hormonal signal to the kidneys that says hold on to everything. Retain sodium. Retain water. Increase the volume at all costs. The result is more fluid in your system, more swelling in your legs, and more strain on the heart that was already struggling. The very system designed to protect you starts working against you. Now add diet to this picture. Most people think of salt as what comes out of a shaker, but 80% of the sodium you consume comes from processed and packaged food: bread, cheese, cured meats, canned soup, condiments. 100 g of ordinary hard cheese contains as much sodium as a bag of potato chips. You do not taste it because fat and flavoring mask it. Many patients who honestly believe they are watching their salt are taking in 3,000 to 4,000 milligrams daily. For someone with heart concerns, the target is closer to 1,500 milligrams. But here is the critical nuance that nobody emphasizes. Sodium restriction alone cannot fix cardiac edema. If the heart is the source of the problem, you must address the heart. Salt management is a supporting strategy, not a cure. This is exactly why many people cut salt aggressively and still swell. They are treating one variable in a multivariable equation. The veins in your legs do not have their own pump. Unlike arteries, which receive blood pushed directly by the heart, veins rely on the muscles surrounding them to squeeze blood upward against gravity. The primary engine for this is your calf muscle. Every time it contracts, it compresses the veins running through it and pushes blood toward the heart. Tiny one-way valves inside the veins prevent that blood from falling back down. This system is called the skeletal muscle pump, and it is one of the most underappreciated mechanisms in the human body. When you sit or stand for extended periods without walking, the pump is idle. Blood pools in the lower legs. Venous pressure rises. Fluid leaks out into the tissue. That is why your legs are most swollen at the end of a day spent at a desk or on your feet in one position. The moment you start walking, the pump activates. Every step compresses, releases, and blood moves upward. Here is the practical part. For managing edema, frequency matters more than duration. Walking 15 to 20 minutes 3 to 4 times per day is significantly more effective than one long walk. Your goal is to restart the pump at regular intervals, not to exhaust it once. If you are desk-bound, do 20 to 30 calf raises every hour. Rise onto your toes, lower back down. That alone activates the pump without leaving your chair, and one habit that can change your nights entirely. 1 to 1.5 hours before bed, lie down and place your legs above the level of your heart for 15 to 20 minutes. The armrest of a couch works. A wall works. Gravity now works for you. It pushes pooled fluid out of your legs and back into circulation. Your kidneys process it while you are still awake. You go to the bathroom before bed instead of at 3 in the morning. Compression stockings are one of the most effective tools for managing leg swelling, and almost everyone uses them wrong. Some people avoid them entirely because they tried a cheap pair once and felt nothing. Others wear them inconsistently, and a surprising number are actually making their swelling worse by putting them on at the wrong time of day. Here is how they work. Graduated compression means the stocking is tightest at the ankle and gradually loosens as it goes up the calf. That pressure gradient mimics what healthy veins do naturally. It squeezes fluid upward, assisting the muscle pump and preventing blood from pooling in the lower leg. When the compression is right, it is one of the simplest ways to support your circulation without medication. Now the mistakes. First, wearing compression that is too loose. It feels comfortable but provides no meaningful pressure. You might as well wear a regular sock. Second, wearing compression that is too tight at the top. That creates a tourniquet effect and actually traps fluid below the band instead of moving it upward. Third, and this is the most common one, putting them on in the evening after your legs have already swollen. By that point, you are trying to compress tissue that is already waterlogged. It is uncomfortable, ineffective, and discouraging. Fourth, sleeping in them. Most people should not do this unless specifically instructed by a physician. The correct protocol is simple. Put your compression stockings on first thing in the morning, ideally before your feet even touch the floor. That is when your legs are at their least swollen, after a night of lying flat. Wear them throughout the day. Remove them in the evening before bed. For cardiac edema, medical-grade compression in the 20 to 30 millimeter H range is typically the starting point. But this must be discussed with your doctor, because in certain arterial conditions, external compression can do more harm than good. If your swelling is cardiac in origin, there is a very high chance your doctor will eventually put you on medication, and that medication can be genuinely life-changing. But I need you to understand what it does, and more importantly, what it does not do. The most commonly prescribed drugs for heart-related fluid retention are diuretics, what most people call water pills. They force your kidneys to excrete more sodium and water than they normally would. The effect can be dramatic. Swelling decreases, breathing improves. The scale drops several pounds in a matter of days, but that weight loss is water, not healing. Diuretics do not repair the heart. They do not reverse the damage. They reduce the symptoms while the underlying condition is addressed through other means. Think of them as bailing water out of a boat while you fix the hull. The second class of drugs targets the hormonal system we discussed earlier. ACE inhibitors and ARBs interrupt the renin-angiotensin-aldosterone loop, that overactive circuit telling your kidneys to retain everything. By calming that system down, these medications reduce the body's drive to hold on to salt and water and lower the strain on the heart over time. The third class is beta blockers. They slow the heart rate and reduce the force of each contraction. That sounds counterintuitive when the problem is a weak heart, but a slower, more efficient heartbeat actually reduces oxygen demand and gives the muscle a chance to recover. Here is the message that matters. Medication works best as part of a system. Medication plus sodium management, plus movement, plus compression, plus monitoring. No single intervention is sufficient on its own, and all medication must be prescribed and monitored by a physician. Never start, stop, or adjust heart medications based on something you read or heard. The margin for error with these drugs is too narrow to guess. Everything I have described in this video becomes harder for your body to manage with every year that passes. This is not opinion. This is measurable, predictable physiology. After 50, the valves inside your veins, the small folds of tissue that prevent blood from flowing backward, begin to weaken. They lose their seal. Blood that should be moving upward starts slipping back down and pooling. At the same time, the calf muscles that power the venous pump are shrinking. This process is called sarcopenia, the gradual age-related loss of muscle mass. Less muscle means a weaker pump. Less pump means more pooling. More pooling means more swelling. On top of that, your arteries stiffen. They lose the elasticity that allows them to expand and contract with each heartbeat. A stiffer arterial system means your heart has to push harder to move the same volume of blood. That extra workload accelerates the decline of an already weakened heart. And your kidneys, the organs responsible for filtering and balancing fluid, gradually lose function with age. Their ability to compensate for excess fluid narrows year by year. All of these changes converge on the same outcome. Your body becomes progressively less capable of managing fluid on its own. The consequences of a struggling heart become more severe, not because the heart itself changed overnight, but because every backup system around it is quietly fading. The clinical data is unambiguous. Early intervention in heart failure dramatically improves outcomes. Patients diagnosed and treated in the early stages maintain a normal or near-normal quality of life for years. Patients diagnosed late, after the heart has remodeled and organs have sustained damage from chronic fluid overload, face a much harder road with far fewer options. How old are you? Write it in the comments. I want to know where you are in this process so I can make the next video hit exactly where you need it. Everything I have told you in this video, the physiology, the warning signs, the salt, the movement, the compression, the medications, all of it is designed to bring you to one decision: get evaluated. Not next month, not when it gets worse, now. The reason most people with chronic leg swelling never get properly assessed is not that they do not care. It is that the system makes it difficult. You wait weeks for an appointment. You get 12 minutes with a doctor who is already behind schedule. You leave with water pills and a vague instruction to watch your salt. Nobody orders the BNP. Nobody schedules the echocardiogram. Nobody connects the swelling in your legs to the heart in your chest. That is exactly why I want to tell you about Care Health. It is a platform that connects you directly with clinical trials and advanced treatment options tailored to your specific condition, including heart failure, cardiovascular disease, and the exact types of circulation problems we have been discussing today. You enter a few basic details, your age, your zip code, your condition, and the platform matches you with active trials in your area. Trials that give you access to specialists, advanced monitoring, and thorough medical attention that a standard office visit simply cannot provide. Many of these trials cover the cost of evaluation and treatment entirely. This is exclusively available to U.S. residents. If you are watching from the United States, this is your window. Click the link on my channel page, or open your phone camera, point it at the QR code on screen right now, and tap the link that appears. If you are watching on your phone, tap my channel profile picture to go to the channel page where you will see the link. A screenshot is on screen showing you exactly where to find it. Spots are limited. These are real medical studies with a set number of participants, and once they fill, they close. Thousands of viewers have already signed up. Every day I hear from people who got matched, got evaluated, and finally got answers they had been waiting years for. Some caught early-stage heart failure that nobody else had flagged. That is what proper evaluation does. Do not bookmark this for later and forget. If your legs are swelling, if you are waking up at night, if you saw yourself in anything I described today, this is the step that turns knowledge into action. It takes 30 seconds. The link is on my channel page. The QR code is on screen. Use one of them right now. This will not be available forever. Clinical trials open and close on their own schedule, not yours. Your body has been telling you something. Your legs have been telling you something. Now you know what it means. The only question left is what you do with that information.